My name is Sadler Meyers. I'm a general surgeon. I do perform a wide range of operations, from the general hernia repairs and gallbladders, which is the most common thing that we do, to more complex surgeries like hiatal hernias and Nissen fundoplications. Some of the procedures that I'm doing are just exclusively done on the robot now, and I think in the future, in 10, 20 years, we'll probably be doing most of our procedures on the robot and not using the traditional laparoscope anymore, just because it's so much easier to do procedures and faster to do the kind of technical parts of the operation. It's important to try to treat the person rather than just the disease itself. And so people come to you when they're not very happy and not very healthy, and it's your goal to try to make them healthier. Now, I can't get some people back to perfection like I'd like to, but I can at least get them better past whatever thing that was causing them the problem in most cases. I want that person to be better, and I want them to know that I care. I just feel really fulfilled with the procedures I do and the people that I treat. To see them go from something that's very uncomfortable or kind of miserable in some cases to be like completely functional all over again is just very rewarding.